St. Peter's Hospital has an outpatient pharmacy. That outpatient pharmacy service is directly connected to the patient's stay as an acute care patient. We have pharmacists that work with their admission plan and also with their discharge plan. The discharge part is mostly carried by our outpatient services. We use pharmacists to talk to the patient, think about the patient's insurance and medical needs as it relates to their budget perhaps. Perhaps there are other reasons why the patient hasn't told the doctor why they don't want to take a medication. We have pharmacists working on that and trying to make things best for the patient. In other words, we take a medication order and we make it the best possible thing that that patient can gain from that medication order. At our St. Peter's Hospital Emergency Department, we have pharmacists stationed to provide emergency services there. Many of our patients do go home from the emergency department with simple things to fix in the ED and then send them home with a prescription. That's not what I'm speaking about. How about if you come in with a heart attack or a stroke or something very serious like that, highly life-threatening? We have pharmacists that are immediately available to address the patient's needs. They're looking at the other medications the patient has taken. They are dealing with many patients, a flow of patients that can be overwhelming because they come in surges. And pharmacists, of course, are attending codes, and they're helping life-threatening situations where patients' lives hang in the balance, and making sure that the physicians and the other care team have the medications, the right medications with the right dose in those urgent situations where clear thinking and clear medication availability has to be secured. And our pharmacists are prepared to deliver that. Pharmacists in the St. Peter's Hospital OR suites provide a very significant service as far as safety. We do cardiac surgeries. We do many different types of surgeries. I understand it's probably about 100 a day or more. The surgery schedule varies like that, and we have pharmacists stationed to meet those patients' needs. Obviously, they come in very early in the morning, and when patients need very specific intravenous drips, very significant different types of difficult medications without perhaps a lot of stability, they are custom compounded in satellite pharmacy. Satellite pharmacists are some of the most skilled pharmacists we have in the facility because they know about how to take care of medications that are used that have onsets of action within seconds. Obviously, when we infuse a medication in the vein, it needs to be right and it needs to be started at the right dose with the right dilution. Pumps need to be utilized. All sorts of technology is involved. Pharmacists have quite a responsibility in many very different ways up on the patient care units, but whether it be the intensive care unit, the critical care unit for cardiology services, other patient care units. For instance, when we are looking at antimicrobials, pharmacists lead the charge as far as prudent use of antimicrobials. We would change broad spectrum agents that are covering a lot of microbes to a focused agent in collaboration with medical staff many times. We are thought of as a leader in Albany, New York, for providing this service. For instance, the service is now mandated by the Joint Commission in Joint Commission hospitals, but we were doing it 10 years before the Joint Commission ever got interested. And that's the type of institution that I'm very proud of as far as St. Peter's Hospital. Another form of stewardship where pharmacists take the charge is in pain management and opiate use utilization. We have pharmacists that are constantly working to manage patients' medication needs in terms of pain control. Opiates aren't the only medication is the message, that there are adjuvant medications and pharmacists are experts in those also. So we have pharmacists that are moving perhaps a patient from an intravenous opiate medication to an oral medication that is safer and better and without those problems associated with opiates. Pharmacists at St. Peter's Hospital are integral to IV product compounding. That IV product compounding basically could be explained as customized infusions for urgent patient care. It's done in the central pharmacy, and it's done by a team of pharmacists, which includes, very importantly, pharmacy technicians. So there are pharmacists and pharmacy technicians providing medications to the floors. You could think of the technicians, their role is delivery to the floor. We use automated technology dispensing that's tied to barcodes for dispensing on the floors. Technicians get all of those meds to the floors in time. Pharmacists coordinate the activities of technicians, and it's really a team approach. It's a 24-hour-a-day, 7-day-a-week factory for for providing specialized, tailor-made medications for each individual patient. And maybe this helps people understand a little bit about where pharmacists are actually making the medication. That happens a lot with IV infusions and things like that. We also do it with barcoding technology. Everything gets labeled with a proper barcode that connects for safety to the patient. If the barcode doesn't line up, the patient shouldn't get it, and the nurse at that point of administration would question, why isn't this